Thank you for joining us today. We'll be discussing the Iowa Medicaid Enterprise Behavioral Health and Substance Abuse Policies and Procedures. This training session is specifically designed to educate providers on the IME policies and procedures related to billing behavioral health and substance abuse for the months of January and February 2016 as we transition to the Iowa Health Link on March 1st, 2016. These trainings should not be used to interpret the billing policies or procedures for services administered by the MCOs on or after March 1st, 2016. This training is designed for newly enrolled behavioral health and substance abuse providers. We will be discussing the following topics. We'll go over the IME eligibility types, billing the IME, the prior authorization process, the forms available and the related policies, as well as resources available to providers and how to contact the Iowa Medicaid Enterprise. First, we will discuss the member eligibility types. Here is a copy of the Iowa Medicaid Medical Assistance Card. Medicaid members carry this card with them to confirm they are eligible for services. The card does not display an eligibility date or span. We encourage providers to contact the IME to confirm eligibility prior to rendering services. Retroactive eligibility. Many members receive eligibility retroactively after being determined disabled or through SSI. In these situations, members are issued a letter or notice of decision on DHS letterhead, which identifies the dates in which they are eligible. This NOD may be released prior to any updates to our system. Providers may rely on this document as proof of eligibility. Any services rendered during this retroactive span should be submitted with a copy of the NOD. We will discuss timely filing as it relates to retroactive eligibility later in the presentation. Medically needy, or spindown. DHS has a program to assist individuals that would not otherwise qualify for Medicaid but have high medical bills. This is the medically needy program. The spindown, which is like a deductible, is met through a certification period where providers submit the claims directly to the IME, which is responsible for calculating the claims and applying the balance to the member's spindown. Once the spindown is met, the member is fully eligible for the certification period. However, is still financially responsible for all claims applied to meet their spindown. Quimby and Slimbe. First, we'll discuss Quimby. Quimby is the acronym for the Qualified Medicare Beneficiary. A qualified Medicare beneficiary is an individual who has Medicare as a primary insurance, and Medicaid will only pay the Medicare coinsurance and deductible. We do not cover the benefits if Medicare denies. If Medicare denies, Iowa Medicaid Enterprise also denies. A Quimby with spindown, where individuals will be able to meet the spindown and determine full eligibility after spindown has been met. In this situation, the non-cover charges are sent to Medicaid for spindown consideration. We also have Slimbe, which is the Special Low-Income Medicare Beneficiary. In this situation, a member has Medicare's primary, and Medicaid will never pay for services. We pay Medicare directly for the yearly premium for this member. Provider needs to bill the member for all services. Finally is Slimbe with spindown. Slimbe with spindown is a member with Medicare as primary. Medicaid is still paying directly for the yearly premium. The member will never become eligible for services. However, the member has a spindown in which to allow individuals, usually within their own family, to actually receive assistance in their home. In this situation, it's the medically needy responsible relative, where an individual has their spindown applied to the household member's spindown to assist them in obtaining and retaining Medicaid eligibility. The IME has the Eligibility Verification System, or ELS, which allows providers to verify eligibility through either a web-based tool or through a dedicated phone line. The ELS phone line is available at the phone numbers listed on this slide. The phone system may be used by any enrolled IME provider as long as the NPI number is active. Providers may use the member's state ID or social security number to confirm eligibility. The system will not communicate prospective dates of service, the current date, and past dates only. There is also a web portal available through the DHS Vendor Electronic Data Interchange, or EDI. This does require providers to register for a login. Providers may request multiple user access for staff, and the web portal link is available at the bottom of the slide. During this transition period and forward, it is important to note the benefit plans available from DHS remains unchanged. The members still have the same coverage and the same network of providers. All services available in 2015 are available in 2016.